Most people think pollution harms only the lungs, but biologically, that's the least of the damage. Think of your body as a home. Air pollution doesn't just enter the living room, it walks into every room quietly. Your heart, your brain, your fertility, even your future children. Last month, I saw a 38-year-old software engineer with arteries that looks like somebody in his 50s. He never smoked. He just lived in Delhi. Pollution is not an air problem. It's a whole body problem. And most people realize it only when the damage is already done. Now, before we go deeper, let me explain one thing very simply. AQI. It's a score from 0 to 500 that tells you that how polluted air is. 0 to 50 is clean. 100 means sensitive people should be careful. 300 means harmful for everyone. And 400 is essentially toxic. But AQI is just the score. The real threat is what forms that score. The tiny particle which is called PM 2.5. Now I know PM 2.5 sounds a little technical, but it's simple. It's a microscopic particle, about 30 times smaller than the strand of your hair. They slip past your nose filters, reach deep into your lungs, and enters your blood and travels to your brain, heart, hormones, everywhere. In cities like Delhi, almost every winter, PM 2.5 becomes so high that it alone pushes AQI to the hazardous level. Over the past decades, some things have changed. You see younger patients every day with more inflammation, early onset of heart diseases, cognitive symptoms in people under 40. And one common factor? Long-term exposure to polluted air. Now Delhi's PM 2.5 levels remain 6 to 7 times higher than the WHO guidelines. That means the body is constantly dealing with inflammation that it was never designed for. You would have seen a recent case, right? A woman left a prestigious job, a UPSC role, because she didn't want to raise a child in Delhi's air. For many, clean air has become more valuable than career stability. Now let's go back to the home analogy. What happens when PM 2.5 enters the body? It doesn't just stay in one place. Starting from the top, it goes to your brain. It affects your memory. It affects your focus. It affects your food. And for some of them, there is a long-term risk of dementia also. What does it mean for your heart? Particle enters bloodstream. It creates low-grade inflammation. It accelerates the plaque buildup. Blood cannot flow easily from your heart. What does it mean for fertility? In men, it means lower sperm quality. In women, it means lower egg reserves and more hormonal disruptions. What does it mean for your children? It means reduced lung capacity, more infection, less school days, less learning. Which are the symptoms that you should not ignore at all? If you're having persistent dry cough, if you are feeling breathlessness while walking, you have daily headaches, you have brain fog, you find yourself sleepy during the workday, you are irritable without any reason, your eyes are burning all the time. One symptoms alone is not enough, but patterns matter. So now what can you do? First, start tracking AQI. Second, you can start using N95 mask outdoors. In your home, start using HEPA purifiers. When AQI is very high, avoid outdoor exercises. In your diet, include antioxidant-rich diet. Make sure you keep yourself hydrated throughout the day. If you are getting nasal irritants, then use nasal saline to rinse it. And if symptoms persist, make sure you consult specialists. So where do you find the specialists? You can go to Practo. There are more than 2 million verified doctors with real patient stories. You can connect with an environmental doctor or a pulmonologist immediately 24/7. You can tell about your symptoms, the exposure that you had, and the doctor will guide you with the right treatment protocol and the tests which you may want to go through. Air pollution may be invisible, but its impact is not. This isn't about fear, it's about early awareness. Take care of your health. It shapes more of your life than you actually realize.